Likhaan and Mae Tao Clinic are both long-term counterparts of Paris, and they both provide health services to marginalized people. This is Mae Tao Clinic on the Thai-Burma border. They provide health care for people who have fled the war in Burma. It was founded by Dr. Cynthia, this is her, and has expanded over its 20 years of operation from a small shed that was famous for using a rice cooker to sterilize equipment into a full community center and hospital. In 2009, over 2,700 babies were delivered at the clinic. Likhaan is based in Metro Manila. It's a community-based primary health organization that works in impoverished urban and rural communities with an emphasis on women's reproductive health and health policy. In 1999, Paris facilitated the first exchange between these two organizations, and over the years, several staff have found opportunities for collaboration. In this photo, Likhaan's ED, Dr. Junis, is accepting the Raymond Magsaysay Award on Dr. Cynthia's behalf, an award Likhaan had nominated her for. This March, when I traveled to Manila to meet with Likhaan, I invited Dr. Cynthia to join me. This was her first time to visit Likhaan's work, and people were really excited to meet her. We spent 3 days in Manila learning about Likhaan's activities, their struggles, and their hopes. Dr. Cynthia was joined by Sophia, who's the head of the Reproductive Health Department, and 2 other health workers, all from the Mae Tao Clinic. That's me on the left. We were hosted by Kiko, an extremely fun and energetic youth outreach worker. Kiko is from Pasay, where an average home is 16 square meters for a family of 8. Likhaan has helped people there organize into a housing association, and they're trying to buy their own land. This is Dr. Junis, Likhaan's ED. We first went to Paradise. Built on a former garbage dump and fish pond, this community, named Paradise, has been working with Likhaan for 15 years. There's a public hospital fairly close by, with an average of 3 people per bed. The paths were filled with children, all running forward asking to be photographed. We arrived at the tiny clinic and toured its 4 rooms. We packed the waiting room and sat and shared stories. While you look at these photos of Paradise, I'll tell you a bit about what we learned about the context in which Likhaan works. Education up to high school is supposedly free, but students have to pay for desks, a guard, toilet cleaning, books, etc. Students often have to share chairs, 50 to 70 students in each classroom. The average dropout age in some areas is as low as 8. Schools are mainly private, and most of these are Catholic schools. The Catholic Church is extremely influential in government policy. Condoms, for example, are not in display in shops, and in some areas of Manila, public funding for contraception has been banned. Only 23% of sexually active young people in the Philippines use contraception. Women have an average of 6 or 7 children, and it is really common to see very young mothers. There are more physicians working in private healthcare than in the public. Most people who get healthcare at all use private services. Basically, those who can afford services get them. Unfortunately, the entire focus of the U.S. International Development Assistance, USAID, since 2003 has been on building private healthcare. Likhaan has set up a pregnant women's insurance program in one of their communities. A small group of pregnant women each contribute a small sum, and these sums are used to support the 1 or 2 women who have a complex delivery. There has been an upsurge in measles, and there's been a decline in the number of breastfeeding mothers, less than 20%, and most feed for just a month or 2, and then stop because they need to work. Malnutrition is therefore a big issue. Likhaan told us that just before our visit, the government had released statistics showing a surge in HIV prevalence, which surprised everyone. They explained that previously almost no one had been tracking HIV as the rates had always been so low. On our second day, we went out to Manila City. A group of Likhaan community volunteers greeted us and described the community in which they work. The former mayor of Manila City had banned all contraceptive services funded by the government. Prostitution of girls is a major issue. One job earns 200 pesos for their pimp and 300 for the girl, while the average total family income is between 1 and 300 pesos per day. Most people have no house, no electricity, and water is really expensive. We pass a place where a woman is selling water, each jerry can, about 20 liters, costing anywhere from 8 to 25% of a family's daily income. This, by the way, is footage of us entering into the compound of Manila City. The Philippines were scheduled to hold local and national elections in about 2 months. Likhaan used to ignore elections, but they realized that they're important to communities, and so since 2004 they have engaged in election campaigns. Given the general's plans for elections in Burma in 2010, all of this was really interesting for our colleagues from Burma. While we were there, Dr. Junis asked the volunteers what would they do if they were the next mayor. They talked about free education and teaching family planning. They all wanted to look at the lack of jobs and low salaries and overcrowding in their communities. One woman said, "We participate in elections because we are interested in long-term change. In the past, we used to vote for whoever paid us." Back at Likhaan's office, we were able to have some discussions around protocols and drugs in reproductive health care. It was a rare opportunity to speak openly about sensitive issues such as post-abortion care, and to compare strategies. Abortions are illegal in Burma, Thailand, and the Philippines, and unsafe abortions result in severe health complications for untold numbers of women. Dr. Cynthia asked about violence against women, and we were told that the norms are slowly changing, that neighbors will now report abuse to police, for example. But divorce is still not a real option for most women. The justice systems continue to privilege men over women. These are pictures of the hospital that we were able to visit on our third day. We met with the head of the obstetrics department, who told us that they had 58 beds with usually 2 or 3 patients per bed, an average of 800 to 900 post-abortion cases per year. They used to receive family planning supplies from USAID that went through the local government, but now these supplies are all channeled through to the private health care. We were given copies of forms for birth certificates and patient records, which will be really useful to compare to the clinic's own templates. One evening we went back to the Likhaan office, where staff and friends all joined us in eating, dancing, and karaoke. Burmese karaoke was a hit. Dr. Cynthia and Sophia taught some traditional dance moves, and Kiko and Junis demonstrated a dance with bamboo poles. There were a few speeches, but mostly this was just a chance for us to laugh together. It really was just an amazing trip.